So hello, happy to see you all again. I'm really passionate about something in my work, and you all have been following and discovering some of my videos over time. A lot about meditation, a lot about interpersonal work and how to do some of these inner processes. And one of the gifts in my life has been working with a dear friend of mine, Dr. Vince. Hey, brother. Good to see you. Good to see you. He's been an amazing influence in really helping me tune into parts of my body and parts of my inner work from another angle. And so I thought I'd bring him in and start working some videos with him and introducing him, because he's been a really strong influence on how I live my life and how I live healthily and continue to expand in my journey. So welcome, Doc.
Thank you, sir.
My honor. So what are we going to talk about today?
Toothpaste.
Okay, so toothpaste.
Most of us go ahead and brush our teeth at least 2 to 3 times a day, as we should, or maybe some people it's only one.
Yeah.
But we always talk about this is the first stage of digestion.
Yeah.
So something we could be doing to benefit our teeth could be ailing our body.
Got it.
And so, should I show the label?
Yeah, we can show the label. I mean, this is YouTube, so feel free.
This is Aquafresh, and again, there's not just Aquafresh, it's all other toothpastes, but the biggest thing that you want to be looking at out there is whitening. You know, we're all trying to get whiter teeth from maybe from teas that we're drinking too much, or from coffees or different things that could be affecting our teeth to tarnish up. And so we're really wanting, you know, there's fluorides, everybody's been talking about that, but we've been seeing in our practice for the last few years a real high significance on the parotid glands, as we've talked about before, is that they're getting over bombarded. And we say this is our first stage of digestion, so we're blowing them out by chemical toxicity, the whitening agent. If you read the some of the trays that you put inside your mouth, or you go to the dentist's office, you're wearing glasses, they have an aerator on you, they have different things. It's done in a doctor's office for a reason. Now they put it in such a minute dose that people are doing it 2 or 3 times a day, 365 days a year, year after year after year, and they can't understand why their body's breaking down. We call that functional illness. Okay. So that functional illness is where all of a sudden they're having problems, but it's not big enough for the doctor to find out.
So you're finding number one problem with toothpaste is the whitening element.
Most definitely, it's a chemical toxicity.
So are you seeing that also in more of the natural toothpaste that are like the Toms, the Jasons, all of the ones that you buy in the health food stores, and it says whitening with that as well? Same problems?
Same problems. It's a whitening. It's a chemical. There's no way. Even the ones that don't have the chemical toxicity, and they say they're putting baking soda in there, this is an acidic environment. This is an acidic environment. And I throw a base in there, I'm changing the acids, so I'm not digesting properly. I had one guy, 35 years, using a baking soda toothpaste, and couldn't understand why he had hemorrhoids and had all types of other digestive problems, and found out we got him off of that, started using what we talked about before, the apple cider vinegar, and all of a sudden, that night, after 35 years, all of a sudden had the best bowel movement. So the body's never too old.
So let me ask this. So if it's if the toothpaste with the whitening is a problem, which ones would you recommend?
Right off the image, you can go to, you know, simple as we've seen is the lavender that we've talked about before from Tom's of Maine. Yeah. We've seen the, you know, you talked about the word, you used the word natural. Yeah. And we have to watch out for that, because companies will use that word and they'll throw that natural product inside there. But sometimes you look at the ingredients, it's not down there until maybe the 15th or 21.
And you all know this. Unless it says organic, it is not organic, right? Even if it may be organic, you can't trust unless it's at a local market where you're actually talking to the person that it may be organic. And if it's not organic, it's likely it's GMO'd. Toothpaste is it GMO'd? But it doesn't matter. It's got everything else,
right? It's got everything else, and it's got all nice funky colors in there for their kids to go ahead and go, ooh, pretty colors. And so...
so basically, what color should the toothpaste be?
White.
White. So it should be white without whitening agent.
Yeah, and it's even like if you look at Tom's of Maine, it's sort of more like an off color. It's like a vanilla color. It doesn't have anything that's going to be pure white. There's some type of agents that still have to make that to be, you know, pure white. But as we start looking at this, is how to allow things to work.
So the other question, because this is a topic that comes up in many conversations in my world, is fluoride. What's your experience with fluoride?
It's one of those. It's a chemical. It's a chemical toxicity, and they've been putting it in. But what's amazing is that the fluoride is a byproduct of aluminum. So,
right. And if it's going, so what people will say is, how can it be affecting me if I'm not swallowing it? I'm not taking it in. So what's your response to that?
the sublingual glands, you have it inside your mouth, and it's there for at least 15 minutes. And we know when we do any type of homeopathic remedy, we're going to go ahead, before you start putting a whole bunch in, about 15 minutes between different products that you're using in homeopathic wise, because the body's going to absorb that. You have your sublingual glands, you have your submandibular glands, you have your parotid glands, all absorbing this tissue through. There's a thing called a neurosublingual response, and we can think about that as a heart attack patient.
Okay.
He has a heart attack, he takes nitroglycerin, he puts it in his mouth, it goes from his mouth to his brain then tells the heart, hey, relax. So
and that actually works.
We know it does from a medical standpoint of view.
Okay, so basically if you're putting it in your mouth, even if you're not swallowing it, you're still having the negative effects, and it's going to multiply the longer you do it.
And even just smelling it
Has an effect.
has an effect.
Okay. So how do you know, how does somebody know if this product or some other product isn't good for them? How do you figure it out?
In our office, and what we've done with a lot of our patients, is we do muscle testing. Some people know that as applied kinesiology. And there's been an array of muscle testing, and what happens is it's very hard because people, it's had this dogma of not being reproducible. And the number one thing in our office is that we're going ahead and doing muscle testing. The practitioner has to be lined up before they check the patient. So
Okay.
in our office we have our staff, and we're always training before the end of the day, making sure that we're working. And we do a simple muscle testing, not if you're stronger than I am or I'm stronger than you, but we're looking for a locked muscle. And when we have a stress, almost like when the refrigerator kicks on in our house, and all of a sudden the lights dim, that's a stress to the electrical system, and then it ramps back up again in that fraction of a second. So the same thing happens when we put something in some of your field, put it in your mouth, or have you smell it, all of a sudden your arm will come down. Okay?
And
I don't
that'll
know
show.
about yours.
That's a whole other story. we'll cover that another day.
All right.
But with this one, so if the arm does go down, it's saying that it's not good. It's not good for you.
It's not working for your body personally.
At this time.
At this time.
Okay. So we're going to have somebody else come in. You're going to test them and go through the process of testing to show whether this product works or not.
Most definitely.
Will you walk them through step by step of how to do this at home? So if they're going to muscle test something, they're working with somebody. A baseline, like you can't. I mean, I know you could teach like a 20-day course on this, but just like a baseline for them to start. Come on in, Brian, and I'm going to step out, and you just walk through this process of what you're doing.
So we're going to go ahead and first we're going to go ahead and check to see how the body is able to communicate. So we're going to check to see if he has a strong muscle to make sure the body's working. So Brian, if I can have your right arm up there.
Okay.
The elbow is going to be straight. The fingers are going to be pointed, sort of like an antenna. The tighter everything is, the higher that antenna, the better reception you're going to get. Okay? So we're going to go ahead. We don't place it over the joint. We're going to place it above the joint. I'm going to bring him down just a smidge, especially for people that are a little smaller and the person's bigger than you. Bring it down. It doesn't, again, it's not a muscle test or muscle strength. We're just checking for tonality. So I'm going to have Brian bring his arm there. He's going to match my pressure. I'm not trying to load him down. Relax for 1 second, Brian. If you've ever driven a car with the stick shift, you have the clutch and you have the gas. If you're on a hill, you let the clutch out just a little bit, give it enough gas, you can maintain right on that hill. And when the body has that stressor, all of a sudden it's like letting out the clutch and the car goes up the hill. We're going to see how something's working here in a moment, okay? So Brian, going to bring up, elbow straight, and we're going to go ahead and check this muscle right here. Elbow, fingers are straight. Here we go. And just match my pressure, Brian. Here.
Okay.
And hold. Good. That's great. That's all I'm doing. And I've got maybe about 2.5, maybe 5 pounds maximum amount of pressure on his arm. So we're going to go to the other place. We're going to go, can I look at your belly button for a second? So this is what we were talking about before. Here's the belly button. The hand, the palm of the surface comes over. We're going to come right over that tissue. Fingers are elongated. And we're going to come through and match my pressure here, Brian. And good. Beautiful. So it shows us that his system is open and communicating. A lot of times we have practitioners, maybe you've been to an applied kinesiology doctor or somebody that does muscle testing, but what happens if they don't check this area, you might get a false positive. So very important when getting checked for any type of product that you're purchasing.
So with that, then, if you're putting your hand over the navel, you're closing off the navel, right?
Right, we're closing out. This is where we're born from, so all of a sudden that major energy source is going to go ahead and be neutral, and all of a sudden his arm. It's the only time the arm should naturally come down. Okay? So we come back through, and we're going to go ahead and check from left to right. We're going to go ahead and see how the tissue, this one he should be strong, and hold for me, match my pressure, he's nice and strong. Release there, come over here again, and he's going to go ahead and bring the pinky and thumb together. He relaxes the arm, and elbow straight, fingers are pointed, and match my pressure. And so now we have strength. Relax your arm for a second. And I do the relaxing the arm, just allow the muscle. Some people this is new, so you're allowing the tissue to relax. So right side, left side are strong. He's open and neutral from the belly button. So now we can go ahead and do the test. We can go ahead and we'll get a positive test here. Okay? So Brian, we're going to go ahead and we have some toothpaste here. Okay. It's got some color in there. It's got some whitening agent. And we're going to see how your body likes this. All right. Okay? And so as we go ahead, Brian's going to inhale this. He's not going to taste it right now. And just having it in his aura, in his sphere of energy, his body's going to go ahead and get weakened. Just like the sun has energy when you feel it through the car window. You feel that energy is 93 million miles away. So Brian, we're going to go ahead and have you bring this up here.
All kinds of yummy colors.
Yum, yum. And just hold it up there. Bring it back up to the nose. We're just going to keep it right there for me, Brian. Fingers are pointed, and match my pressure for me. Okay. So right there, he's got some muscle strength, but he doesn't have the tonality of how that tissue is able to go ahead and work inside of his body. So some of the aspects when we look at this is we said there's red dyes in here, there's different colors, and whitening is probably the biggest thing that weakens the parotid glands.
So, so then with this, the one question I have that's coming up when you say this is, some of you out there may be saying, well, if he's already telling him that he's going to be weak, is that creating the response to that? So can you direct them and tell them?
Most definitely. I thought that when I started 16 years ago as a chiropractor, and I was in clinic, and I thought about suggestive thoughts. And every day for the last 3.5 years, as we've been taking care of patients clinically, we see changes that are happening with them. And then all of a sudden, you have them overlapping, and I go, oh, this one's got to be the gallbladder, this one's got to be something. And all of a sudden, I'm proven wrong. So there's suggestive thoughts. If the body likes it, it likes it. If it doesn't, it doesn't. There's no, I can't will this person, unless we're going ahead, and I guess if we're dealing with possibility of voodoo, it's about how maybe some people might think of this.
Like really high level of...
Yeah,
but the way that you're suggesting, you're saying it's not having an impact.
Because we're dealing with a neurosublingual response. We're dealing with the limbic system, so it's not me going ahead and telling him that his body's weak, and he has... So even if I go...
Because his body is weak because of this, not because of your suggestion.
Right, but let's do that. This is a perfect example to help this. So Brian, I'm going to have you smell this again. Mm-hmm. This is a fantastic product. It goes ahead, bring that up to your nose.
This is so good for you, you can't believe it. Believe it. Just imagine yourself strong and good with this.
This is a product and allowing the system. It's going to really allow your body to flourish. It's going to bring the health to your kids and just allowing the body to be able to communicate and work. And so there again.
And you're not doing any stronger with your push.
No, and to be clear, from a receiving standpoint, I can, activate that muscle. It's not completely collapsed on me, but it is a significant and palpable difference in how much effort I have to make in order to keep my hand there. Even though his pressure is the same, I have to work a lot harder, and that's the biggest difference. I know it doesn't always necessarily translate on camera, but when you're receiving that, you can feel a chemical shift, or physical shift, in how you're responding.
So to encapsulate what we're speaking about here with specifically toothpaste, what would you say?
I would really go ahead and make sure that the toothpaste, your viewers out there are really ahead of the curve on making sure the stuff that goes in their body is working to its best. It's really making sure that we're not looking at, we have toothpaste that doesn't have whitening agents, it doesn't go ahead, the chemical processing, it's really minimized. So when you look at your ingredients, that's going to be a key factor.
So what would be the things that you don't want in there? I mean, you probably could just
the major one we don't want in there is sodium lauryl sulfate. Sodium lauryl sulfate is going to be a detergent. It's going to cause things to foam up.
So that's SLS, right?
Yes.
So SLS is the, you'll see with a lot of the natural toothpastes, if it doesn't say SLS free, you got to look at the back. It most likely has SLS in it.
And this, again, for this work we've been doing, we've been doing this for 3.5 years, we used to carry a homeopathic toothpaste. And we talked about not having it. And so just because in my mindset I said it was a homeopathic toothpaste, and then all of a sudden Jason said, hey, well, but this has it in it. And I'm like, oh, okay. But it also brought us 3.5 years later to looking at that Jason's body and his resonant factor is so much higher than the average person.
So we're not going to go there today.
But we
But
would.
that has an importance with muscle
It
testing.
does.
Okay.
It does.
So the whitening agent, SLS, fluoride,
Colors.
colors, anything else? Basically, if it's Colgate, Crest, Aquafresh, it's going to have fluoride at least in it, and a whitening agent,
Yeah, it
and
has
other
to.
toxins.
Yeah.
So you're going to have to go to a natural product that is SLS free, and a non-whitening agent, and
No color.
no color.
Right.
Okay.
And usually you're going to pay double the amount.
So like $6 to $8 probably.
Sometimes even $12.
And then you still need to muscle test it.
So, because you got to make sure it's working for your body. And so now the more organic it is, it doesn't have all the preservatives in there.
Yeah.
So now the shelf life of using that product.
So it may be past its shelf life, and then it won't be good for you.
Exactly. And, so,
And again, if you're putting it in your mouth.
the parotid glands go and
Okay.
it shuts down the immune system.
Awesome. Thank you all. I hope this helps you. And if you have questions, you can go through my channel, but I'm also going to, at the end of this, we'll be also directing you to Dr. Vince's channel and his email as well. So many blessings.
Thank you.
Thanks, Brian. I appreciate it.
Absolutely.